I'll speak to you in Swahili. Hamjambo. Bonjour. Bon dia. I speak some 5 languages, so I'm happy that you all know these languages. And right now I'll use English, that I think is familiar to all of you. Yeah, so my name is Nathan Mulure. I come from Kenya. I came with a few Kenyans here. Maybe I can ask them to just lift their hands. Dr. Kiliko and Dr. Mwenda, and some other more Kenyans there, and Tony from Uganda. Good morning, all of you again. Great. So I work for Novartis, the social business head for East and Southern Africa, based in Nairobi, Kenya. And I'm very much happy to be here today to be amongst Christians. Usually it's very rare for us to attend Christian organizations and speak. Usually it's the secular organizations, the medical associations, the universities, but I'm very happy to be here amongst Christian brothers and sisters, and gives me great pleasure and great joy to be able to partner with the CCIH. It's my first time to come to CCIH, and I bring you greetings from my colleague, Hans Rietveld, who was here last year. He couldn't make it this year, but he sent me with greetings to you, and he said, Nathan, you're gonna be fine. You're gonna have a lot of fun being in the house of the Lord amongst your brothers and sisters in Christ. So thank you for making me feel very warm and welcome in this congregation. Novartis is a pharmaceutical company, and we do manufacture drugs. Our main core business is manufacture of drugs, medicines, and our mission and aim is to extend and improve lives on this earth. Yesterday I was asked, is Novartis a faith-based organization? And I said, we are actually a private, secular organization, but we have a lot of faith in what we do. And because of this faith, we have come to partner with a faith-based organization. Already we are partnering a lot with the MEDS and CHAC in Kenya, and we're also looking forward to partner with the Uganda Protestant Medical Bureau and Catholic Medical Bureau in introducing our program into these countries for us to be able to reach people in these regions. So a brief history about Novartis. It's a Swiss-based company. The headquarters in Basel, Switzerland. Basel is a small town where French, Germany, and Switzerland meet. All these 3 countries converge in Basel. That's where our headquarters is. And we have operations in more than 100 countries, in the US, in Southeast Asia, in Africa, employing about 144,000 people, operating in 100 countries. So it's a large multinational organization, but that has a focus on social business to increase access to medicines in lower income countries and also in Africa. For a long time, we have done a lot of work in malaria. How many have been to Africa here? All of you have been to Africa. Wow. How many have had malaria? A lot of you have had malaria. How many have never had malaria? A lot have not had malaria. If I ask this question in this place in 1860s, everybody would have said they've had malaria. Because in the US at that time, malaria was also very endemic. It was as endemic as heart disease. Do you know that? That Washington had lots of malaria in the 1860s? That Tennessee Valley was full of malaria? But they managed to eradicate malaria in 1950s after a Marshall Plan. Malaria was eradicated. Very recently, it's not a long time ago, that we had malaria. And I remember I was reading the history of malaria, and they would say that Congress would close in May. Congress would find posters in Washington, posters saying malaria is coming, close, shut down, go back to your countries, to your states where there's no malaria. You can imagine that it is only 200 years ago that malaria was so endemic, but they managed to eradicate malaria in the US and other countries as well. In Africa, it's still a big problem. And to date, every 60 seconds, a child dies of malaria. When I joined Novartis in 2006, the statistics were very grim. It was every 30 seconds, every 30 seconds a child was dying of malaria, every 30 seconds. But he did a lot of work on malaria, and bed nets came, and spraying came, and we managed to reduce this to, as we speak today, every 2 minutes, still a child dies of malaria. Every 2 minutes, a child dies of malaria. It's a disease that we know so much about. We know how to treat, how to prevent, how to avoid mosquitoes, but it's still killing so many of us. Why is this so? That is why Novartis put a lot of effort in trying to combat malaria. And this started about 16 years ago when we had a very good product that we were about to prune, as we call it in the industry, or to exterminate or to excise from our production facilities, because it wasn't doing very well. And it was only selling probably 100,000 treatments every year. And our CEO at that time, Dr. Vasela, asked his board members, what is this drug? He was told it's malaria, an anti-malarial drug. And asked, why is it not selling a lot? Saying it's very expensive. Malaria only belongs to Africa as we speak today. And Africans are not able to afford this drug. It was going for about $12 a treatment. So we had a brainwave, and he approached the World Health Organization and signed an MOU to provide this product at not-for-profit to the public sector. It was a very bold decision for the company, because it was easier for the company to just kill this product and move on with life. So the MOU was signed, and thereafter, we started producing this drug at not-for-profit at about $1 to the patient, from $12 to $1. And we started seeing a lot of uptake. And Zambia was the first country to take this anti-malarial and even change policy. Because at that time, chloroquine was failing, and SP also was failing. And I recall as a boy, I used to have malaria lots of times. A lot of times I used to have malaria. Because in Kenya, at that time, we used to have this notion that you have to go and visit your countryside every school holiday. It was fun to go home. It was excitement. You go into the train, full train, it's a third class because you couldn't afford second class or first class. So you take third class and even sometimes sit on the floor as you go all the way. So it was fun. But we had malaria many times. And I am thankful now that I'm working for a company that is at the forefront of combating malaria. And because of our efforts and other people's efforts, we have managed to reduce the incidence of malaria by half over the last 10 years, by half, by 50%. And that is published in the WHO statistics. Now we are going beyond malaria. We are now venturing into social business or non-communicable diseases, NCDs. And we're offering a basket of drugs to countries and FBOs at the cost of $1 per treatment per month. The same spirit that we had with malaria, we want to replicate this in NCDs. And we're working with MEDS in Kenya, and we shall have a panel discussion in the afternoon where we can actually share a little bit more of what we are doing. And through this NCD program, we want to tackle diabetes, breast cancer, hypertension, and asthma with drugs that ordinarily would go for $140, $100, $50 in the private sector, to offer these drugs at only $1 in the faith-based organizations and in the public sector. So we call upon all FBOs who are here. We would like to partner with you. Kenya already, we have strong partnership with MEDS in Cameroon, Baptist Convention. They've already gotten their first supplies. Uganda is in the pipeline, Tanzania in the pipeline, and we'll come to your countries to talk to you and introduce this program, and hopefully we'll be able to forge strong partnership in this fight against NCDs, because it's the next pandemic. We must tackle NCDs. We must reduce the incidence of NCDs. Thank you very much. My time is up.